For this next circulatory system video, we have the blood vessels. And so in lab, you're being asked to distinguish between arteries and veins, and then more specifically between muscular and elastic arteries. And so to help do that, I have first this figure out of a textbook just to highlight some of the similarities and differences between arteries and veins. And then we'll take a look at some of the histology slides that you'll be looking at in lab. So the first thing to point out about both of these is they're made up of three layers. And these three layers are the tunica intima or tunica interna, the tunica media, and then the outer tunica externa. And so if we consider the tunica intima or tunica interna first, this is composed of a simple squamous epithelial layer, or also known as the endothelium, and then a loose areolar CT layer that supports that. This endothelium is the same endothelium that you find in the endocardium, so that inner layer of the muscular wall of the heart. That endothelial layer is then continuous with this endothelial layer that we see in blood vessels. And this is both true in the arteries and the veins. The next layer, the middle layer, is the tunica media, and this is predominantly smooth muscle. That is definitely true here in the vein and in one particular artery that we'll look at. And then outside that is the last layer, and this is the tunica externa. And this is a connective tissue layer. It's going to be some loose areolar followed by some fibrous layers. And this is going to help support the vessels as well as integrate it with the surrounding connective tissue. Some of the differences that you'll notice, the vein on the right here, the tunica externa tends to be the thickest layer. Here you can see it's about the same size, if not a little bit thicker than the tunica media. And that's true of the veins that we'll be looking at in lab. So again, for the veins, the thickest layer tends to be this tunica externa. Whereas in the arteries that we'll look at, it's the tunica media that's going to be the thickest layer. So here we can see a very prominent tunica media, predominantly smooth muscle, followed by a relatively thinner tunica externa. And so the relative thickness of the tunica externa versus the tunica media is a good characteristic to use, as well as we'll see, some of the characteristics related to the lumen. And so here's our first histology slide, and this is used to illustrate two very extreme, nice examples of an artery on the left and a vein on the right. If we take a look at this one on the left, we'll notice that it has a nice circular lumen. So this is the central area of the lumen where the blood would be. You'll notice on the right in the vein that that lumen is collapsed. Now that's not always the case, but it tends to be the case in the slides that we have, where the lumen of the veins tend to be collapsed, whereas the lumen of the arteries tend to retain their sort of circular shape. And this is primarily due just to the thickness of the supportive walls that make up the artery compared to the walls of the vein. And so if we shift our attention to the left here onto the artery, this is going to be an example of a muscular artery. So again, we have two different types of arteries we're going to look at. There's the muscular artery that we see here, and then there's the elastic artery, which for us is going to be the aorta slide. And so some of the features that allow us to say that this is in fact a muscular artery is the presence of these two very prominent dark squiggly lines. These are elastic laminar. These are elastic layers. And so arteries, in addition to having the smooth muscle, typically also have elastic fibers throughout. And when it comes to the muscular arteries, that elastic layer is confined to this internal layer here, and then to this external layer. There will be a few elastic fibers throughout the tunica media, but not very many relative to this very, very prominent purple line that we see here. This is the internal elastic lamina, and then the outer external elastic lamina. And so these two elastic layers, both on the inside and the outside, become a very nice defining feature of these muscular arteries. And so if we were to look closely, and we'll look at the next slide, there should be a very thin tunica interna, which we can't really see here, it's too thin, followed by then this very nice purple prominent line, the internal elastic lamina. Then we're going to have our tunica media, the smooth muscle layer that makes up the majority of this muscular artery, followed by this next dark purple line. This is the external elastic lamina. And then outside that is going to be the tunica externa. And so if we take a closer look at the same slide, just at one particular area, we can now start to see that very thin pink cellular layer here. This is going to be that tunica interna, right? This is that simple squamous layer with a little bit of loose areolar to support it. And so it is not the purple line here. This purple line is that internal elastic lamina. The tunica interna or tunica intima is actually going to be inside that. And so this very thin pink layer that's just inside the purple line, this is going to be the tunica interna. This very, very nice, darkly stained elastic layer, this is going to be a nice characteristic of those muscular arteries. And then we can see here this very thick tunica media. This is that smooth muscle layer. There's going to be a little bit of elastic tissue in here, but nothing like we see here at the inside or the outside of this layer. And so outside the tunica media is then going to be this external elastic lamina, this external layer of elastic fibers. And outside that, we can see a very nice tunica externa, and this is that connective tissue layer. We have, as a result, a lot of fibroblasts. And so typically in this tunica externa, we're going to find some elastic fibers, but then also we're going to see a lot of nuclei, and these nuclei represent the fibroblasts that are helping to maintain this extracellular matrix that we associate with connective tissue. And so going back again, this is a really, really, really nice example of a muscular artery. It's going to have those two elastic lamina, the internal and the external, that border the tunica media in the middle. This slide, this is of the elastic artery. So the only example we have in lab is of the aorta. So the elastic arteries, these are the biggest arteries that we have. So the pulmonary arteries and the aorta are two good examples of elastic arteries in our body. And the big difference, and then hopefully you can notice this here, is that the elastic tissue, or those elastic fibers that were confined to the internal and external elastic lamina in the muscular arteries, are now found throughout the entire tunica media. And so in this example, here's the lumen. And so if we could look very, very, very closely, we'd see a thin layer here, the tunica interna, followed by then a very, very thick tunica media. Now the big difference that we see here is that the tunica media is actually predominantly elastic fibers, and there's also going to be some collagen fibers in there. And so smooth muscle is not the primary tissue that you find in the tunica media in this case. It's going to be these elastic fibers and collagen, and that's what's going to allow these to have this nice elastic property, which is very important. If you think about the aorta, during that contraction of the ventricles, the aorta is under really, really, really high pressure. And that high pressure is going to cause these these arteries to expand a little bit. Because they have this significant elastic tissue throughout the tunica media, they're able to recoil during that period of relaxation. And so it's very important at the aorta and the pulmonary arteries, the arteries really close to the heart, that they can accommodate that very high pressure during contraction, but then also can snap back, recoil during those periods of relaxation. And so we find these elastic arteries associated with the major veins, arteries coming off of the heart. So again, the big difference is the lack of a prominent internal and external elastic lamina. Here we can see the elastic fibers throughout the entire tunica media. And then just as before, we're going to find the tunica externa. And so in this slide here, this layer that I'm highlighting, this is going to be the tunica externa. Again, this is going to be a CT kind of fibrous, also loose areolar CT layer. Now, something that we can see in this field of view, which is going to be associated with these large, large veins and arteries, is going to be these three little vessels right here. And so the largest of our arteries and veins, in this case the aorta, they require their own vessels. And so these are the vessels of vessels, and this is referred to as the vasa vasorum. That's a number 4 on your lab list, the vasa vasorum. These are small vessels that supply the wall of these large arteries and veins. And so the tunica externa and the outer area of the tunica media, they're too far, they're too distant from the lumen to be able to acquire the resources they need to support the cells and the tissues in this area. And so these large vessels have their own blood supply, they have their own vessels. And again, here they are. Now, sometimes you'll look at a view and you may find prominent vessels out here. These vessels are not part of the aorta. This is just surrounding the adipose tissue and connective tissue. So you want to make sure that you're looking within the tunica externa. And so these vessels that you find just inside the tunica externa, these are going to be those vasa vasorum. So don't look for vessels outside the tunica externa. Those are just going to be other vessels related to the surrounding connective tissue. And so here we're back to that first slide again on the left. Now we can really see the difference between this, the muscular artery with the two very prominent layers of elastic fibers, as opposed to the elastic arteries, which have layer after layer after layer of elastic tissue throughout the whole entire tunica media. And so the other type of vessel that we're having you look at in a lab are going to be the veins. And so again, going here to the right, we can see a vein. And as I mentioned, veins often have this collapsed lumen. And as I said at the very beginning, they also should have a relatively thick tunica externa relative to their tunica media, right? And so the relative size of the media versus the externa can often be used as a nice characteristic to define if we're looking at an artery or a vein. And so here, this is going to be a vein, and we'll take a closer look at this here. And we can see that, in fact, there is a pretty thin tunica media, in smooth muscle layer, followed by a very, very thick, fibroblast-rich tunica externa. And so this becomes the thickest layer, this nice supportive tunica externa that's going to hold it, as you can see here, to the surrounding adipose tissue or other connective tissues in that area. And so veins tend to have the collapsed lumen. They tend to have a thick tunica externa relative to media, whereas muscular arteries, they're going to have the relatively thick tunica media in relation to the externa. And as a muscular artery, it's going to have these very prominent elastic layers, the internal and the external elastic lamina. Whereas our third, the elastic arteries, they're going to have the elastic layers throughout, alternating throughout the entire tunica media. So again, this whole thing here is the tunica media, followed by the tunica externa. And in our aorta slide, we're also going to be able to find these small vessels that help nourish the actual walls of this aorta. Again, these are referred to as the vasa vasorum, or the vessels of the vessel. And so hopefully that helps with these few slides we have related to blood vessels.